Wonderful, thank you. And yeah, I'd like to also extend a warm welcome to Glasgow and Scotland. And I'm going to spend the next 10 minutes speaking with you about some of the evolutions in the science of nuclear medicine. The first session I'm going to highlight is the PET physics session. So this is taking place just after this session and after you've had a coffee. And this session is very varied. It covers quite a lot of topics, but 3 of the presentations are on a whole body PET CT scanning. So I've kind of focused on them just to give you some signposts as to presentations you might want to look at. 2 of the presentations are from the Royal Free Centre, and the first one is doing a comparison really between different modes of imaging, so either static or continuous bed motion with the whole body PET CT. And they've also got a presentation looking at what should we do when we get patients with different BMIs? How should we change the acquisition and the reconstructions? And there's a presentation to talk us through that. There's also a presentation from some of our industrial colleagues. So presentation 6 is looking at a proof of concept study exploring the extraction of an ECG signal from the rubidium PET images. So it's an image-derived ECG from these images, and we're grateful to the continuous collaboration, of course, between industry and our imaging services. And I think this is quite a nice presentation that kind of highlights that. I'd like to really emphasize, though, that for all that I've selected some whole body PET CT presentations, which I totally appreciate are only available in a small number of centres. There's without a doubt going to be benefits that come to us all over time from the learning from the centres that have these scanners and from our industrial colleagues who are continuously developing PET CT technology. And then, I suppose on a similar theme, there's a session later today looking at SPECT CT and some of the developments in that field. And again, a very varied session looking at some of the really important work in SPECT CT on quantification, and also the harmonisation of quantification, a challenge for us all. And really from that, trying to reap all the benefits of the new technology as it comes on board. So I've selected a few presentations to signpost on newer technology, on CZT scanner technology. The first one I have selected is using a combination of AI, which we're all clearly going to see much more of in years to come, using AI to assist attenuation correction in some cardiac CZT scanning applications. And then also at presentation number 24, again a CZT scanner, and the group from the Royal Brompton are going to present some work that they've been doing, looking to see how much they can reduce the administered activity to the patients whilst using the new CZT scanner technology. We've also got a presentation from the Swansea group in that session using the CZT scanner for DAT scan images and comparing the newer technology with the more conventional sodium iodide crystal technology. But again, for all that I've selected maybe some of the more cutting edge technology, I think it's important for everybody to be forward looking and appreciating that there will be downstream effects for all our services as this technology becomes more prevalent and available to us all. Later on today, there's an intriguingly entitled session named Exotic Pet. And yes, the image in the bottom right is from Scotland, which is up in the Isle of Harris. If anybody ever gets a chance to go, it's a beautiful, beautiful place. And from this session, I have selected a couple of presentations to signpost. So session 27 is from a team here in Glasgow, in the University of Glasgow, where they are looking at a tumour segmentation using artificial intelligence approaches. So this particular one is using a deep learning, statistical learning approach, and the application for this presentation, looking at standardising tumour segmentation, is in the field of lymphoma. And I particularly selected that presentation because I think it very much combines some of the technological evolutions in nuclear medicine with the Professor Sally Barrington's lecture this year, where she's going to be sharing with us some of her lifetime's work in lymphoma imaging, and very much a kind of very key part of nuclear medicine services. And then another presentation from the session, a little bit of a unique or a bespoke application of a PET CT scanner. Some colleagues in Coventry and Warwickshire are going to tell us about using a miniature PET CT scanner in an intraoperative environment, where they're using the scanner to assess the resection margins on the samples taken in theatre following 18-fluorine FDG administration. So a couple of kind of maybe more forward-looking applications, but again, ones that we will hopefully all be reaping the benefits of in the future. There's a session devoted to the physics of molecular radiotherapy tomorrow morning, and I've put the slide down at the bottom right here, which shows us some of the beautiful landscape in Skye, but it also, I suppose, emphasises the important, and nowhere more so than in molecular radiotherapy, where we have to proceed as a team with skill, planning and care in order to achieve our targets and be successful together. So I've selected a slide, first of all, on the bottom left here, a slide with an image, a graph and an equation. So clearly I couldn't resist it. This is from the group in UCL looking at partial volume correction methods in paediatric MIBG therapy. So quite a few very good presentations in that session, and another one from colleagues in Imperial, where they are going to tell us from a physicist perspective about their experience with a trial looking at the radspherin, so an alpha-emitting radionuclide therapy. But again, as I say, from the physics perspective, so we'll tie it in with the kind of clinical perspectives that will be given elsewhere. So continuing on the theme of, as Simon was saying earlier, some of the work that we do does carry some risks, and as always, we will, as a team, proceed with skill, planning and care, and we've got a whole session on Wednesday morning given over to a range of topics, including risk assessments, skin dose assessments, and all the kind of topical issues within nuclear medicine safety, I suppose, from a scientific perspective. And within that presentation, there is a team from the Royal Free, so Joe Page and Peter Marsden, are going to share with us some of their experience working alongside the HSE in the completion of HSE administration consents. So I'm sure many people are looking forward to getting the benefit of your experience and seeing some of your top tips. Wonderful. So it just leaves me to wish you a very successful BNMS here in Glasgow. I hope you have a wonderful time, meet some new people, learn, and also find some inspiration to take back to your hospital sites and services. Thank you.